So let's begin general pharmacology with some terms and their meanings. First is pharmacology itself, where pharmaco refers to drugs and logy refers to study. So pharmacology is obviously the study of drugs. What kind of study exactly? For example, there's paracetamol. Under pharmacology, you would have to study about the structure of paracetamol, the use of paracetamol, the side effects of paracetamol, the action of paracetamol, the dose of paracetamol, the duration when the paracetamol is supposed to be taken. All the stuff that you need to know about drug comes under pharmacology. Like, what does paracetamol look like? What are the uses of paracetamol? What happens when you take paracetamol? What does your body do to paracetamol? How does paracetamol even work? What's the amount of paracetamol to be taken? And when is it supposed to be taken? Everything that you need to know about a drug comes under pharmacology. Once you have done pharmacology, once you have gained enough necessary knowledge about drugs, you end up practicing it, and that's pharmacotherapeutics. Pharmacotherapeutics refers to practicing pharmacology. So once you have gained enough information about drugs and various kind of diseases, you can use drugs for the treatment of diseases, for the prevention of diseases, for the mitigation of diseases. You start practicing pharmacology for the betterment of society, and that is pharmacotherapeutics. Then next is chemotherapy, where chemo refers to chemical and therapy refers to treatment. So chemotherapy refers to the treatment of diseases, using chemicals. And by chemicals, we mean using drugs, because drugs, after all, are chemicals. So treating diseases with the help of drugs is chemotherapy. Usually the term chemotherapy is used with cancer and infections as well. Next, pharmacy. So pharmacy, it is a branch that deals with number 1, preparing, number 2, preserving, number 3, compounding, and number 4, dispensing. Dispensing of what? Dispensing of drugs. So basically, pharmacy is that branch which deals with making of drug, then storing drug, then mixing drug, and then giving away drugs. So pharmacy is a branch that deals with making of drugs, storing drugs, mixing drugs, and finally giving away drugs. Preparing, making, preserving, storing, compounding, mixing, and dispensing, giving away. That's pharmacy. Pharmaceutics. Pharmaceutics is similar to pharmacy, but when the stuff or the process are done at a larger scale. Basically, the large scale manufacture of drugs comes under pharmaceutics. Then toxicology. Study of poisonous effects of drugs comes under toxicology. So when you take drugs in an inappropriate amount, maybe at a dose or at an amount that is higher than the recommended dose, then it may lead to some poisonous effects in your body. And the study of those poisonous effects and the study of ways to mitigate those poisonous effects, the study of preventing such effects from happening comes under toxicology. So under the definition of each and every terms, we see a certain word repeating again and again, and that is drugs. Because pharmacology is study of drugs, pharmacotherapeutics is practicing the study of drugs, chemotherapy is using drugs for treating diseases, pharmacy is making, storing, mixing and giving away drugs, pharmaceutics is large scale manufacture of drugs, toxicology is studying poisonous effects of inappropriate use of drugs. After all, we are talking about drugs, right? But what exactly is drugs anyway? Paracetamol is a drug, but why is it called a drug? Here's the best definition of drug. So, drug is a chemical with known structure that alter the pathophysiology for therapeutic gain. I know that the definition sounds too long, but the meaning behind it is not. See, let's break the long definition into parts. So, drug, it's a chemical. The structure of that chemical is known. This chemical, when introduced into our body, brings some kind of change in our body. And the type of change that it brings is for our health gain. For example, paracetamol. Is paracetamol a chemical? Yes. Do we know the structure of paracetamol? I mean, at least the pharmacist knows, so yes. Does paracetamol bring some kind of change in our body? Yes, when the fever is too high, when the temperature is too high, upon taking paracetamol, it decreases the temperature of the body by bringing some kind of change in our body. So yes, it does alter the pathophysiology of the body. And is it for a therapeutic gain? Yes, we are taking paracetamol to get rid of fever. So it satisfies everything that's mentioned in the definition. So paracetamol is a drug. So what's a drug? A drug is a chemical. Paracetamol is a chemical whose structure is known. The structure of paracetamol is known that brings some kind of change in our body. Paracetamol decreases the temperature of our body by bringing some kind of change in our body. That is, it alters the pathophysiology of the body for a therapeutic gain. Yes, we take paracetamol for our gain. How? In order to get rid of fever. So that's what a drug is. Drug nomenclature refers to the naming of the drugs, and there are three different ways in which a drug can be named. There's the chemical name of the drug, the non-proprietary name or the generic name of the drug, and the proprietary name or the brand name of the drug. What's the chemical name? So, chemical name of a drug is based on the structure of the drug or the structure of the molecules that is present in the drug. However, the chemical name of a drug is too long. For example, this right here is the molecular structure of a drug, of a certain drug. The IUPAC name of this molecular structure would give the chemical name of the drug. However, the IUPAC name is too complicated and too long for different types of drugs to be remembered. So instead, some systems were made that assigned these drugs with a much more abbreviated names. So the abbreviated names assigned by the various systems. You will come to know what I mean by various systems. By various systems is the non-proprietary name or generic name. And this generic name can then be easily used by common people or maybe medical practitioners. And finally, there's the proprietary name or the brand name. It is basically the name of the drug given by the manufacturer. And that's why it's called the brand name or the company name, manufacturer. So what are the three types of names? There's the chemical name, which is based on the structure, non-proprietary name or the generic name, which is the abbreviated name, and proprietary name or brand name, which is the name given by the manufacturer or the company of the drug. Now let's look at the example of each types of naming. First is the chemical name. This right here is the molecular structure of a certain drug. The IUPAC name of this molecular structure would give the chemical name of that drug. However, it is far too complicated to remember the chemical names of various drugs that exist in this world. So instead, certain systems were made that have given a much more abbreviated or smaller names to these various drugs that can be used universally. For example, this drug that I have shown here, or the molecular structure that I have shown here, is of paracetamol. So, paracetamol. Paracetamol is a generic name which has been given by INN. The word paracetamol or the generic name paracetamol is used in Europe, Australia, New Zealand, India, and obviously in Nepal as well. Similarly, the same drug is also given the generic name acetaminophen. Acetaminophen is the generic name given by this system called USAN, and it is used, the name is used widely in United States of America. Finally, there's the proprietary name or the brand name. So the same drug has been given various names depending on who is the manufacturer of that drug. For example, there's Panadol, which is a paracetamol, Tylenol, which is a paracetamol, Calpol, which is a paracetamol. Why different names? Because these are the drugs prepared by different companies or different manufacturers. Similarly, in Nepal, people popularly use Nico and Dolopar. However, Nico and Dolopar are not exclusively paracetamols. They contain paracetamol, which is an antipyretic. Anti means against, and pyretic refers to pyrogen that increases or elevates the temperature of the body. So it's against temperature, it decreases the temperature or mitigates fever, plus analgesic or painkiller. So the mixture of two is used as a tablet and manufactured by various company in Nepal, especially Nico and Dolopar, which is the brand names of these two drugs mixed together. So these are the various types of drug nomenclature. There's the chemical name, which is based on structure. The IUPAC name of this structure would give the chemical name of the drug. There's the non-proprietary name or generic name, which is the abbreviated name given by various systems of the world. For example, the INN system gives the name to this chemical paracetamol, which is widely used in Europe, Australia, New Zealand, India, and Nepal. And the other system, USAN, has given the name to the same drug, acetaminophen, which is a generic name widely used in United States. And third is the proprietary name or the brand name, which is given by the company of or the brand that manufactures that drug. For example, Panadol, Tylenol, Calpol. In Nepal, Nico and Dolopar are widely used during fever. Nico and Dolopar are brand names and they contain antipyretic paracetamol as well as analgesic in a mixture. So here's a very small case study for you guys. I was told to go to a pharmacy and bring Lulican cream. Okay, so the name of the cream is Lulican cream. However, the pharmacist told me that they no longer had Lulican cream. Instead, they had Lulifast cream. See, now here's the dilemma. I don't have extreme knowledge about these creams, nor do I have a doctor with whom I can get an instant contact with to ask about such stuff. So the best thing I could do was look at the composition of both these creams. Sure, one is Lulican cream and the other is Lulifast cream. However, Lulican and Lulifast, they are just brand names. Both of these creams, they contain lulicanozole. If you look at the composition of both these creams one by one, so in Lulifast, the composition is, it's on the other side. So in Lulifast, the composition is lulicanozole 1% weight by weight. In Lulican cream, the composition is also lulicanozole 1% weight by weight. Since both of them contain the same chief ingredient in same percentage by weight or in same amount, I was able to buy this or get this even when this was not present in the pharmacy. Now let's look at the various types of drugs. First, prescription drug or legend drugs. Prescription drugs are those drugs that can't be sold without prescription. That is, if a person wants to buy this drug from a pharmacy, he has to present a prescription from an authorized medical practitioner. He can't just go to a pharmacy and ask for one of these drugs and get it without any prescription. For example, sleeping drugs, antidepressants, you need a prescription to buy these drugs because these drugs, they can be easily misused, and if misused, they can bring great harm to your body. They are legend drugs because they are legendary. They can't just be bought without any prescription. You need a prescription for it. Next is non-prescription or over-the-counter drug. Non-prescription drugs, as the name suggests, are the drugs that can be bought without any prescription. Basically, you can just go to a pharmacy, ask for this drug, and they will hand it to you. Obviously for a cash, not for free. Usually, these drugs are the drugs that are for cough, cold, acne, diarrhea, constipation. For example, if you have a high fever or a high temperature, you would go to a pharmacy and ask for paracetamol. They'll give you a paracetamol and you can easily take it without providing them with any prescription. So paracetamol is also an OTC or a non-prescription drug. Third, orphan drug. Orphan drug are the drugs that are used for the treatment of rare disease. Okay, fine. Orphan drugs, drugs used for the treatment of rare disease. But why the name orphan? Why is the drug associated with the word orphan? What do you understand by the word orphan? Orphan is a child who doesn't have any parents, right? Who is the parent of a drug? The parent of a drug is the manufacturer of the drug. The company that manufactures the drug is the parent of the drug. And what's the motto of any company? The main motto of any company is to gain profit. Now here's another question. Would a company gain profit if it sold medicines for common disease or if it sold medicines for rare disease? Obviously, if it sold medicines for common disease, because if a disease is common, there are more patients would buy more drugs, and then there's more profit. However, if a disease is rare, there are less patients, which would lead to less selling of the medicine, and then there would be less profit. That is why companies, they focus on making drugs that can be easily sold or drugs that treat common diseases. Since drugs that are used for the treatment of rare diseases hardly get any patients, they are not manufactured by companies. And since they are not manufactured by companies, they are basically orphan. That's why called orphan drugs. Fine. Next, illicit or street drug. Illicit refers to illegal. Street drug because it's sold on street. That's why. So illicit or street drugs are the illegal drugs of abuse. Basically, these drugs are sold illegally and then abused. For example, LSD, angel dust, crack, cocaine, heroin, narcotics, marijuana, amphetamine. And if you know more examples, you should be focusing on non-prescription, prescription, and orphan drugs rather than illicit drugs. Why do you know more examples of illicit drugs? There's something wrong with you. Okay, so that's your illicit drug. Next, spurious drug. Spurious drugs are imitation drugs, basically a copycat. For example, there's a situation where the demand of drug A is very high. A certain company decides to make a replica of drug A without using the main ingredient or the chief ingredient of drug A. Since the company doesn't use the chief ingredient, the manufacture cost is very low. However, on the labeling of the drug, they mention that the chief ingredient has been used. Basically, they give fake information and start selling the same drug at a much cheaper price. What happens? We people like Bheda Bakra start buying the cheaper medicine. but don't realize that at the end of the day, the drug is actually fake and it does not bring any kind of change in your body. So the copy of the actual drug made by the company for the reason of profit, that's your spurious drug. Imitation drug, copy drug, or what else can you say? I don't know. That's your spurious drug. Okay. Next, prototype drug. There are various drug classes. For example, opioids. Under opioids, you can find multiple drugs. One drug among all those multiple drugs represent them all. For example, under opioids, morphine represents the characteristic of all the drugs that come under opioids. So morphine is a prototype drug. Basically, prototype drug is an individual drug that represents a drug class. So morphine is an individual drug that comes under the drug class of opioids, and the characteristics, chemical and physical features of morphine can be used to relate with all other drugs that come under the same class of opioids.